Welcome to this educational video about compressive optic neuropathy. Today we'll explore what this condition is, what causes it, how it affects your vision, and the available treatment options. Understanding this condition can help you recognize the symptoms early and seek timely medical attention. Compressive optic neuropathy, as the name suggests, arises when the optic nerve, responsible for transmitting visual information from the eye to the brain, is squeezed or compressed. This compression can stem from a variety of sources. Common culprits include tumors located near the optic nerve, such as meningiomas or pituitary adenomas. Other potential causes include aneurysms, which are abnormal bulges in blood vessels, orbital lesions, which are growths within the eye socket, and even bony abnormalities that narrow the optic canal, the bony channel through which the optic nerve passes. In rare cases, inflammatory conditions can lead to swelling and subsequent compression of the nerve. When the optic nerve is compressed, its delicate nerve fibers are damaged. This pressure disrupts the flow of nutrients and oxygen to the nerve cells, leading to their dysfunction and eventual death. The severity of the damage depends on the degree and duration of the compression. Prolonged compression can cause irreversible damage and permanent vision loss. The specific areas of vision affected depend on which part of the optic nerve is most affected by the compression. While precise numbers are difficult to ascertain, compressive optic neuropathy is a relatively uncommon condition. The prevalence largely depends on the underlying cause of the compression. For example, the occurrence of optic nerve compression due to meningiomas will be related to the incidence of meningiomas overall. Similarly, pituitary adenomas are a more common cause than some other rarer etiologies. It tends to affect adults more often than children, and the risk may increase with age due to the higher likelihood of developing conditions like tumors or aneurysms. However, anyone, regardless of age, can potentially develop this condition. The symptoms of compressive optic neuropathy can vary depending on the severity and location of the compression. The most common symptom is gradual, painless vision loss, often starting in one eye. This loss can manifest as blurred vision, dimming of vision, or difficulty with peripheral vision. Color vision may also be affected, with colors appearing less vibrant. Some individuals may experience visual field defects, such as blind spots in their vision. In some cases, patients may notice pain with eye movement, particularly if the compression is related to an inflammatory process. Double vision may occur if the compression affects the nerves controlling eye movement. It's crucial to note that these symptoms can be subtle initially, so any changes in vision should be evaluated promptly by an eye care professional. Diagnosing compressive optic neuropathy typically involves a comprehensive eye exam. This includes assessing visual acuity, visual fields, color vision, and pupillary responses. Your doctor will also examine the optic nerve using an ophthalmoscope to look for signs of swelling or pallor. Imaging studies such as MRI or CT scans are essential to visualize the optic nerve and surrounding structures and identify the cause and location of the compression. These scans can reveal tumors, aneurysms, or other abnormalities. In some cases, a lumbar puncture may be performed to rule out inflammatory or infectious causes. Visual evoked potentials of VP can assess the electrical activity of the optic nerve and help confirm the diagnosis. While not strictly classified into types, compressive optic neuropathy is often categorized by the underlying cause of compression. This could include compressive optic neuropathy due to a tumor, such as a meningioma or pituitary adenoma, compressive optic neuropathy due to an aneurysm, compressive optic neuropathy due to an orbital lesion, and compressive optic neuropathy due to bony abnormalities. Identifying the specific cause is critical for determining the most appropriate treatment strategy. The primary goal of treatment for compressive optic neuropathy is to relieve the pressure on the optic nerve and prevent further vision loss. The specific treatment approach depends on the underlying cause. If a tumor is the culprit, surgical removal is often necessary. Radiation therapy, such as stereotactic radiosurgery, may be used to shrink tumors that are difficult to remove surgically or to treat residual tumor tissue. For aneurysms, endovascular coiling or surgical clipping may be required to prevent further growth and compression. In cases of inflammation, corticosteroids or other immunosuppressant medications may be prescribed to reduce swelling. Regular monitoring of vision and optic nerve function is crucial to assess the effectiveness of treatment and detect any recurrence of compression. In some instances, even after the compression is relieved, some vision loss may be permanent, necessitating visual rehabilitation. Unfortunately, there is no specific way to completely prevent compressive optic neuropathy, as many of the underlying causes, such as tumor formation or aneurysms, are often unpredictable. However, maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking, may reduce the risk of some conditions that can indirectly contribute to nerve compression. Regular eye exams are crucial for early detection of any vision changes or abnormalities that could indicate a problem. Promptly reporting any unusual symptoms to your eye doctor can lead to earlier diagnosis and treatment, potentially improving outcomes. The prognosis for compressive optic neuropathy varies significantly depending on the cause, severity, and duration of the compression, as well as the timeliness and effectiveness of treatment. Early diagnosis and prompt treatment generally lead to better outcomes. In some cases, vision can be fully restored after the compression is relieved. However, if the nerve has been severely damaged, some degree of permanent vision loss may occur. Research is ongoing to explore new therapies for optic nerve regeneration and neuroprotection, which could potentially improve the long-term visual outcomes for individuals with compressive optic neuropathy. Recent studies are investigating the use of stem cells and other novel approaches to promote optic nerve repair. Keeping up to date with the latest research and advancements in the field is essential for both patients and healthcare professionals.